Welcome to the HIT department's tips and tricks. This video will show you the new controlled substance chronic pain HPI. Now, where you're going to find this is right on this list. It's not here now, but it'll be under here. It will be listed as controlled substance / pain, and I'm going to show you what it looks like. So there are a number of things in this that we can show you. Now the first thing, the source of pain / diagnosis, you can do one of two things. You can either free type in here, or if you click on the drop down, you're going to have your list of diagnoses. So you can add cervical disease, chronic pain, etc. The same thing under your medications. You can either free type, or if you have the medication already in the medication list, then you can simply add it from the list. Now, one of the beautiful things about this is that when you do fill these out, what's going to happen is when you make the agreement, this will already be filled in. This will not translate to the assessment, though you will have to put the assessment in. Now, next thing in the corner, the ORT is the opioid risk tool. And when you click on this, you can go through with the patient and fill this out. We should be doing this with every patient at least once. And you can score it, and it will show up here. Now, one of the things for the source of pain, the medications, and the screening, once you fill it out once, it will stay in the system and it will go forward. You can update it if need be, but this will go forward in the patient's chart. Now, the morphine equivalent, you can put the date that you calculate it, and then you can using one of our calculators, you can calculate the morphine equivalent and add that in. Now we have our A's here, the analgesia right here, the activity, adverse reactions, adjunct medication, aberrant behavior, and it's pretty straightforward. So again, in the activity, are they worse, are they improved, are they stable? The adverse reactions, do they have constipation, do they have sweating, etc. Adjuncts, right here, again, you've got a couple of areas. You have current, past, ineffective, and decline. So again, they're currently on anti-inflammatories. They've had gabapentin in the past. They've had physical therapy, but it's been ineffective, and they've declined chiropractic, for example. And again, with co-management under here, you've got the same thing. Have they been seen in the past by rheumatology? Have they been seen for surgery and it's been ineffective? So you can document these things. Over here is diagnostic, so you can document whether or not they've had a x-ray and the date of that x-ray. So we'll say 2018. And finally, in this corner over here with the compliance, you've got a number of things. Unfortunately, it will not pull from the controlled substance agreement, but you can document the day that you do the agreement. You can document if you pulled from the cures database, and you can have your staff document when was the last urine tox screen, and was it consistent or was it inconsistent. You can also free type in here as well. Finally, you have visit comments and historical comments that you can add. You also have the ability to use my phrases and create my phrases. And I'll show you what this looks like really quickly. So if there are any questions, as always, please feel free to ask your back office supervisor, your regional medical director, or anyone on the HIT team. Again, this is part 1 of the controlled substances chronic pain tips and tricks, and part 2 will go over the agreements and medication tips and tricks. Hope you have a good day.